Hello, leaders of the world. Welcome to Spread Love in Organizations, a podcast for purpose-driven healthcare leaders striving to make life better around the world by leading their teams with genuine care, servant leadership, and love. I'm Naji, your host for this special episode in partnership with MIT Sloan Healthcare and Bioinnovations Conference, an event that brings the healthcare ecosystem together. I'm joined today by Dr. Assaad Sayah, President and CEO of Cambridge Health Alliance. Assaad was named CHA's President and COO in January 2020 after serving as the interim CEO since June 2019 and Chief Medical Officer since 2013. Before that, he served as the Chief of Emergency Medicine and Senior Vice President for Primary Care. In the emergency department, he led tremendous advancements at all three CHA hospitals, resulting in enhanced efficiency, quality, volume, and patient satisfaction. He spearheaded in primary care growth by more than 50%, expanded CHA's access in underserved communities, and integrating primary care and behavioral health services and systems to address social determinants of health. Assaad also plays a key role in CHA's commitment to the communities it serves, including his tenure as the co-chair of the Cambridge City Managers Opioid Working Group, established in 2018, to develop recommendations for strengthening the city's response to the opioid epidemic. Additionally, he is assistant professor at Harvard Medical School. His research and publications focus on operational efficiency, improving the clinical environment and patient experience of care. Assaad, I'm really humbled to have you with me today.
It's a pleasure, Naji, and thank you. It's truly an honor being here.
Before we dig in value-based care, the topic of your panel at SHBC, I'm eager to hear your personal story. What brought you to medicine, ER, and now running Cambridge Health Alliance and having such a tremendous impact on the communities you serve?
Well, I appreciate it. It's a long story, but I will keep it abbreviated. As far as medicine, this is a calling. As far as I can remember, I always wanted to be a doctor, even before I knew what doctor is all about. I am the first college grad in my family, never mind a medical professional. And I have truly the privilege of representing my community and my ethnic background. I am Lebanese in origin, in the greater Boston area. Medicine to me is truly more of a calling than a profession. And what got me into emergency medicine is two reasons. One, I am an adrenaline junkie by nature, so anything that's up and running and exciting, I'm into it. And the second and more important thing, it is truly doing the right thing, because historically and even currently, the emergency department is the only place where anybody can get care regardless of their ability to pay 24/7. And, this is a place where you get care and then we ask you for your insurance card, versus anywhere else, as far as that I know, you have to present your insurance card before you get your care. For whatever it's worth, that's what brought me into emergency medicine. What got me into administration is curiosity and my difficulty in accepting things not working very well around me. So I always ask the question, how can we improve things? How can we do things better? And when you ask those questions, people say, well, go at it. If you can do it better, go ahead and give it a try. The more you try, the more you do, the more people ask, and one thing led to the other. And here I am, the CEO.
Let's start now with value-based care. How would you define this?
So value-based care is the combination or the formula that combines quality and cost. So if you want to say value equals quality over cost, the higher the quality, the better the value. The lower the cost, the better the value. The worst situation is an environment where you have low quality and high cost, no value at all. So you want to improve to the best you can, the level of quality while managing the cost. And the difference between current value-based care and other attempts at managing healthcare cost is the equation that involves quality. Because if you go back to the 90s, during managed care, it was only managing cost, and there was no alignment of incentives. And with value-based care, one would think that the incentives are aligned between the patient who want the best quality, the organization that wants to provide excellent quality and get the best reimbursement, and the payer that want to manage cost. And hopefully that combination is the magic sauce that will lead to the best work and the best healthcare environment.
So you touched upon those the key players. So can you frame specifically who are the key players and what really needs to change today for us to be able to achieve high value-based care?
Obviously the three major players in healthcare, I mean, there's a lot of players. You want to add the government and policymakers and communities, et cetera. But the three big buckets are one, the consumer, that's the patient. And that's the most important piece of all of healthcare. We're all here for the patient to do the right thing. And the patient, what the patient wants is great quality and the best experience possible that is timely. And that there's a level of commitment and trust, because trust is absolutely critical in healthcare. What the provider wants is the appropriate resources to provide the needs and meet the need and exceed the needs of the patient in an efficient way. And that requires funding and the right policies and the right, et cetera, and the right training. And what the payer wants is a partnership with the provider where when they give the provider the resources, because the payer doesn't practice medicine. The payer is basically the vehicle between the patient that's paying premium and the provider that's providing the care. And they want to make sure that as the care is provided, it is provided at a good cost, at a good price. The new paradigm is adding quality to the equation, is putting certain metrics that are reportable, that are measurable, that at least directionally define the level of quality that is provided.
So do you think we're well equipped as a society to get there? And really, I would love your thoughts on health equity within this scope.
Yeah. We're still trying as far as value-based care. And in my opinion, so far, it is the best formula that has the highest probability of success. Believe it or not, healthcare in general in the United States is all still fee for service, which means you do something, you get paid for it. Just like, when you call a plumber or electrician to your home, they come, they do the work, you pay them, they're done. But you don't know, you can't evaluate the quality of their work. It could be great for the first day, the first week, the first year, but it could falter after that. And that's basically fee for service. There's an hourly rate, you get paid for it. The incentive in here historically is the more you do, the more you get paid. But that's not good. At the end of the day, you want to make sure that you get the best quality, the best value for that job that you're giving to your plumber. Let's say that. In the value-based care, basically you get paid a certain amount to provide a certain amount of care at a high quality. So the best way to cut down the cost is provide less care or enough care, but with the highest quality possible. And that's how you manage the level of the cost of healthcare. That's really going above and beyond. It's always almost 30% of the GDP today. And some reports say that it's higher than that. So it's going to break our society if we really don't manage our cost. Now, when you add the equity to the equity piece to the formula, and as a healthcare organization, we are the only public hospital in the state, and our mission is to serve a safety net population, historically and continuously. And that population historically has been underserved and under-resourced at all levels, including with healthcare. Because one, the demand is greater. This is a patient population that has a lot of complication, whether it is mental health or social determinants of health, food, transportation, housing, you name it. A lot of this patient population is first-generation immigrants. Many, they don't speak English. They have issue with housing density. Many families are living in very small, very tiny, tight quarters. So there's a lot of challenges in here. They're all working difficult, many low-paying jobs to really make ends meet, which complicate things. They complicate the ability to get healthcare. They complicate their ability to get to be transported there, to make certain appointments, to take time off of work. When they get there, their ability to communicate, understand, and follow directions, ability to get medications and follow medications. That patient population is very complicated anyways, not only the immigrant patient population, but also the patient population that is less resourced from multiple ways, whether it's financial, societal, education-wide, or even their ability to have access-wide. That's where equity plays a big role, because historically, we have not invested as a society in improving the condition, the living condition of that subpopulation, so we can provide them, so we can keep them healthy and not only care for them when they're sick.
So can we double click on this, because I know you're doing a huge work and impacting those underserved population, and you shared about social determinants of health. So can I get your view about this and how you have been leading your organization specifically to improve healthcare delivery for those underserved communities?
One is you have to identify that community. So we are in the community. We do have 12 clinics out there, all embedded in our communities. All our clinics have primary care and behavioral health, and to a certain extent, even dental involvement. So we can provide comprehensive care to the patient when they get there, not sort of shuttle them all over the place. We have invested in our multicultural department, and that's a department that is for the community, by the community, that provides not only interpreter services, but also support in multiple ways, speaking over 100 languages out there, available in person and sort of virtually. And our ambassadors are not only there to interpret when the patient shows up, they're also there to support the patient in their community. So, if they need the medication, they're connecting them with the pharmacy, finding ways to get the medication at a discount or for free, linking them to certain resources and grants so they can get appropriate support, not only in healthcare, but in housing, food, social services, etc. Going with them to follow up appointments, advocating for them when it comes to immigration law, etc. So they're involved at all levels, not only to support that community, their community, because they come from that community, only in the interface with healthcare, but in general to make their environment more conducive to being healthy.
I love that, being there with them. It's powerful. I will now give you a word, and I would love your reaction to it. The first one is leadership.
Leadership is setting a strategy and creating a team that is committed to this strategy and to the work that needs to happen.
Can you tell us more about it? I'd love to hear your story and how you do it with your teams, because you have a large team, committed, and I'm sure you've gone through a lot. with pandemic and even today with everything happening around you. So I'd love to know how you keep your people engaged towards this purpose.
Well, I mean, the most important role of a CEO, and I call it being a cheerleader. You have to be positive. You have to smile. You have to be a resource. You have to be available, and you have to make sure that you're surrounded by people that are smarter than you, and that believe in the mission and the work that you're doing. Because one person cannot change the world. You cannot do the work yourself. You have to provide the environment and the resources for the people to do the work, and the space for them to do the work. It includes trust, which is the most important element in a team. And it includes clarity, transparency, and accountability. And it's a two-way street. I work with my team as a family. God knows we spend more time with each other than our own families, and we rely on each other, good, bad, or indifferent, every day to really do the work and make sure that we are maximizing and optimizing the resources we have, the opportunities we have to better serve the community and support each other.
I love it. What about care delivery?
Care delivery, I don't like that word, to be honest with you, that terminology, because it's so narrow, believe it or not. But in general, care delivery is meeting and exceeding the expectation of the patient in the communities, and going above and beyond. The healthcare system can do so much and has the ability and resources to do so much. Unfortunately, that is not matched with the needs, and it's not matched with the expectations and the knowledge of the patients in the community. So we can do a lot more than we do, and we should be able to do a lot more than we do. So care delivery traditionally is the organization that provides care to the patient when they're sick, when they need it. In my mind, the best way to improve care is to provide what's needed, what's necessary for the patients to remain healthy in their communities, and not prevent them. Every time a patient comes to the hospital, or most of the time they come to the hospital, it is a failure of the care delivery system, in my mind. So the ultimate success is be out of business, believe it or not, and decrease the needs, the traditional needs of the patient to really consume the amount of care that they consume.
So true. You're touching on prevention, how we do it, health education.
Absolutely. All of the above. All of the above. 80% of people's health, or over 80%, happens outside the traditional healthcare system. It is what happens at home. It is the habits that happen at home, whether it's smoking, obesity, you name it, drugs, alcohol, psychological issues, food, transportation, you name it. That's what influences people's health. There's a piece that's related to the genes, what you're born with, and there's a piece that's related to everything else we do to keep you healthy. But the big chunk of it is what you do every day. And that's what we need to invest, where we need to invest in early prevention, in screening, in early childhood screening and prevention, in education of the families and the kids, so they have healthy habits, so they remain healthy.
So the third one is health equity.
Health equity is, and this is not equality, and this is not, it is basically be thoughtful and purposeful in defining and bridging the gap in the gaps in our society between the safety net, and the rest of the population that has a gap. And so it's not giving everybody an equal amount. It's defining the gap and providing extra resources to bridge that gap at all levels, whether it is in healthcare or you name it. There is equity in the digital divide. There's equity in finances. There's equity in education. There's equity in healthcare. There's equity in culture. I mean, you name it. There's a historical gap that happened over decades and hundreds of years that the only way to mitigate that is to provide the appropriate resources to narrow that gap. So the amount of growth and the amount of resources has to be exponentially greater here, so we can make up that gap with time. Otherwise, if it's equal, there's always going to be a gap.
The last word is spread love in organizations.
We talked about trust, we talked about working as a family, we talked about approaching things the way you want to approach things, the way you should be approached things. And I have certain rules that I live by. One of the rules that you hear about is, treat people as you want to be treated. And that's not my rule. My rule is you got to treat people the way they want to be treated. Because that's a big difference. You can assume how you want to be treated, and that may not be satisfactory to others. And I think that's a very important piece in love, because you cannot, in love, you cannot project your own definition. You have to project the other person's definition of what love is about, because that's what matters, is to the other person is what they define it, not how you define it. And that is true across all our society. And if we approach things the right way, the way we conduct and live our life, not only professionally, but with family and neighbors and society, I think that's what matters, is treat people the way they want to be treated.
Any final word of wisdom, Assaad, for healthcare leaders around the world?
Do the right thing. That's another piece. And you're always seeing challenges and always facing issues that sometimes are unsurmountable. But at the end of the day, we're all judged based on the work that we do. And at the end of the day, the best way to be judged is for doing the right thing. And sometimes it may not be the most beneficial thing or the most lucrative thing. But doing the right thing always, at the end of the day, will lead you to the right place.
Well, thank you so much. I can talk with you for hours, but I know you have to go, and it's been really an incredible pleasure to have you with me today. Thank you so much for joining me.
Pleasure, Naji, and good luck to you. Thank you very much.
Thank you all for listening to Spread Love in Organizations podcast. More episodes summarizing the MIT Sloan Healthcare and Bioinnovation Conference are available on SpreadLoveIO.com or on your preferred streaming app. Follow Spread Love in Organizations wherever you listen to podcasts, and spread the word around you to inspire others and amplify this movement our world so desperately needs.